Well, good afternoon, everyone. Thank you for joining us. My name is Jeff Donnell, and I'm president of Enterprise Health. And I'd like to welcome you to the Get Ready for the Next Set of Waves webinar, focused on actions that several innovative organizations are taking to respond to the COVID-19 pandemic and to anticipate what may be coming next. And this is actually the sixth in a series of webinars that we initiated earlier this year in response to COVID-19. And we're excited to report that we have more than 450 individuals who've registered for today's session, which is outstanding. We want to thank all of you for taking the time to attend today, and we want to thank our friends at the BRI Network who helped us to promote the event. Just a couple of housekeeping items. We've muted everyone except our moderators and panelists on entry to minimize background noise, but we are recording this session. So we will email everyone who registered early next week with a link so that you can access the recording and share it with others. We're using WebEx today, and that's been a successful platform for us. Hopefully we won't see any glitches given the large numbers that we're expecting, but hopefully everything will go well for us. And we've got a really outstanding panel today. We've put together a group of occupational and employee health experts who include Enterprise Health clients and partners. And we've asked each panelist to make some initial remarks about their observations on today's topic, and then we'll have a Q&A session. You can submit questions via the chat feature in WebEx, and then we'll get to as many of those as we possibly can after each of our presenters shares some of their material with us. Joining me today to help moderate is Ashley Ross with BRI Network, and BRI is a leading organizer of conferences and events in healthcare, pharma, biotech, finance, and other industries. So thank you, Ashley, for joining us today. And before we turn it over to the panelists, I'm going to quickly provide some context on our organization and today's topic. So if you had the misfortune to ride on an elevator with me, and of course in this day and age, we'd be wearing masks and standing in opposite corners of the elevator. But if you ask me who is Enterprise Health, this is what I would say. We're the only cloud-based health IT solution that combines occupational health and compliance, clinical care, and employee engagement on a single interoperable certified electronic health record platform. And our focus is on helping our enterprise clients and their employees have a healthier future. We work with a nice roster of blue chip global corporations, government agencies, hospitals and health systems, and universities, who operate their own on-site employee health clinics and provide employee health services to other organizations as well. And when it became apparent early this year that COVID posed a very serious threat, we started to work very collaboratively with our existing client community to respond. And fortunately, the Enterprise Health solution already included a really important set of building blocks to help our clients react. So we already had pandemic response, case management, medical surveillance, encounter documentation, lab ordering and lab results delivery, employee engagement. So we were able to work as a community to rapidly configure this functionality to help our employer clients manage workforce health and safety in response to what was happening with COVID-19. And our clients began using our application to manage things like employee travel, to monitor employee symptoms, to handle testing programs, to document things like work from home accommodations. And after working and refining this with our existing client base over a couple of months, we realized that a lot of this capability would be really valuable to people who were not our clients. So we actually packaged all of this up and launched Channel 19 as a standalone application to help really any employer organization, manage and monitor employees for COVID-19 symptoms. And we've since developed Channel 19 and deployed it in corporate, university, health system, and government settings all across the United States. And we're continuing to refine and improve the application. We continue to layer on new capabilities like telehealth and contact tracing. And our clients have been able to successfully manage return to work. And we're also using this application ourselves for our own employees when they work on site at our offices. And what's happened most recently here, just in the last couple of weeks, is we've started discussions with several of our clients to prepare for COVID-19 vaccination programs, which is something that's certainly in the news a lot these days. And again, we're going to be able to modify our existing mass immunization functionality that most of our clients use very frequently to manage employee flu vaccination programs, but we're adjusting that existing functionality in support of COVID-19 requirements. I'm sure that many of us feel like we've been hit by a COVID-19 tsunami over the last several months, as this pandemic has really had an outsized impact on our lives, on our organizations, on the health and safety of our employee populations since early this year. And we've rapidly figured out, how to shut down, how to dial back, how to work remotely. We've ramped up testing. We've developed different strategies to return essential employees to work and keep them there. And we've invested in technology to support all of these efforts. And as many predicted, what we've seen is sort of a shark teeth pattern of outbreaks, followed by lulls, followed by more outbreaks, with different regions experiencing a different set of troughs and valleys. And things are happening certainly in waves. We see people embrace wearing masks, then people stop wearing them, then people start wearing them again. We see people who've been really diligent early on about social distancing, then they kind of let their guard down, then they start to get diligent again. We're seeing things like outbreaks that are tied to events ranging from, big motorcycle rallies in Sturgis to the resumption of classes at schools and universities. And the impact of all these different waves can certainly be a challenge to wrap one's head around. And changes that many of us thought would be temporary have been extended and in some cases are going to become permanent. For example, many organizations who were reluctant to consider remote work as an option are now really embracing it as a new way to operate. And they recognize that at least in some industry sectors, the benefits far outweigh the drawbacks. We're seeing that traditional colleges and universities, where the educational mix, usually favored in-person learning over online instruction, that many of them are now conducting almost all of their classes online, even for on-campus students. And we've also seen hospitals and health systems have migrated en masse and very rapidly to telehealth as a viable care option, and many expect that will continue long after this pandemic ends. So as all of this unfolds, employers have implemented a wide variety of measures to protect their employee populations, and most have continued to refine their approaches to deal with not only what's happening today, but to anticipate that next set of waves that's coming our way. And today we're fortunate to have a great panel that's going to share some of the innovative work that they've been doing in response to COVID-19 and in preparation for what might come next. So these surfers, if you will, have been riding some pretty gnarly waves, and we're really excited to hear what they have to say. So leading off for us today is Dr. Charles Williams, and Dr. Williams is Senior Director for Corporate Health Services at Eli Lilly and Company. And Lilly has been a longtime client of ours. They've been a great partner. We've been collaborating closely with them since the start of this pandemic. And Lilly has been at the forefront of COVID-19 testing efforts. And now they're working on a new clinic concept that's really, really exciting. So let me turn it over to Dr. Williams, and I will pull up your slides and advance them for you.
Thanks, Jeff. And at the mercy of everybody's eyes, I'll go ahead and turn my video on for just a few moments while I go through the slides, just to kind of make a little additional connection. First of all, thanks to Enterprise Health for having us and asking us to participate in this. It's an incredible opportunity, really, to kind of share some of the things that we've been doing, and I'm happy to be able to bring at least one of the unique kind of response initiatives that we've put forward here at Lilly, Indianapolis, at our corporate headquarters. And just for a summary for the group on the call today, Lilly in business for over 140 years. We've got, as Jeff said, we have a longstanding relationship with Enterprise Health, with WebChart as our platform for documentation for our occupational and our non-occupational services that we provide. Our corporate headquarters is in Indianapolis, Indiana. We probably have a physical presence of about 75 different countries across the globe. But our largest presence in one concerted location is in Indianapolis, Indiana, where we have a corporate headquarters and the main U.S. manufacturing facility, and have about 15,000 employees in the greater Indianapolis area. So when COVID-19 hit, it was pretty significant, and we've been really from day one, we've been earnestly engaged in what can we do to manage this pandemic that we knew was really coming. We have about 4,000 employees in our China operations alone, so we were really in it from the front. I've been with the organization, it'll be 4 years in November, and tell people it's the best job I've ever had. So, Jeff, if you'll go to the next slide. When I joined Lilly, actually, if you can believe, we actually had a life that existed before the COVID-19 and the SARS-CoV-2 virus. We have 2 on-site medical clinics, one in our corporate headquarters, and then one in Indianapolis, and then one in our main U.S. manufacturing facility. It's about 5 miles away from the main corporate headquarters. One of the things that I brought to senior leadership pretty early on was the risk that actually influenza brought to our population. You can see some of the statistics. This is actually 2018, 2019 data that U.S. employees missed over 17 million work days a year just due to influenza, and it really had an impact of over $7 billion in sick days and lost labor. Not only that, but, and that's just U.S. numbers. Not only that, but whenever a employee or a patient came into one of our clinics that was infected with influenza, there was a potential exposure of my healthcare staff in the facility to that virus that could be potentially transmitted. So I actually had conversations with our senior leadership very early on in my tenure here to talk about how could we enhance the infection control measures actually of the facility itself while we were doing the infection control measures from our employee and healthcare staff. And really didn't get a whole lot of interest peaked because we dealt with influenza all the time. Well, lo and behold, then come the ends of December and January, February, March, and we've all been introduced to SARS-CoV-2 and then the illness COVID-19 that results from that. And lo and behold, there was a new and refreshed interest in what can we do not only to protect our employees, but to protect our facilities, including our facilities that had to provide medical care for occupational and non-occupational needs for our on-site employees. So a lot more interest in that, and we were able to really kind of put forward a unique response initiative that I wanted to talk to you about. So if you think about some of the kind of core problems that we addressed, really, because Lilly has the essential function really to produce and deliver life-saving medication kind of across the globe, there was really the inability, like many, if not all of the people, your operations and your organizations, to really stop the operations. We very early on moved a large majority of our non-essential people off campus in order to get appropriate social distancing and to follow a lot of the guidelines that were coming forward. But we had to keep essential manufacturing operations open, as well as we transitioned our clinical diagnostics laboratory into an infectious disease laboratory so that we could do primary reverse transcriptase PCR testing, not only for Lilly employees and contractors, but for the general public. And we were one of the first locations, and we were the first location in the state of Indiana to actually do mass COVID collection drive-through that we maintain still to today. And that actually ended up being a key facilitator for what we're going to talk about next. So we really had the inability to stop those operations. We had to keep people here at all times 24/7 in order to keep our operations going. We knew that because the illness would become and has become endemic, that we would have employees and contractors who would be presenting, would be on campus asymptomatic but infected, as well as those that would become symptomatic whenever they while they're on campus and at work. And we knew that the process that we have is that those individuals would come to our employee health services clinics to seek care. So we knew that there was an existing risk of exposing our facility itself, the medical clinics we had itself, to potential secondary contamination. And we knew that there was a tremendous amount of limitations in early testing capability, and that there are continued limitations on access and then really turnaround times for the tests that are being obtained. So since our facility developed our own reverse transcriptase PCR testing and our own drive-through facility, we were able to turn around samples that we collected in less than 24 hours, which was a tremendous opportunity for us within Employee Health Services to use our own capability to help evaluate our employees and contractors that were symptomatic and or at risk of potentially being exposed through testing. The key was, how do we do it? We had really our two priorities really were employee safety and our ability to continue to produce and deliver life-saving medication. And then really our third priority was to do the most we could for the general population as a whole. So one of the things that any of you, if you've had opportunities to be associated with a hospital system, or you may have heard quite a bit about this, especially early on, is the hospitals that had the highest level of capability in the early response to the pandemic were those that had the ability to really isolate, to identify and isolate individuals that had a contagious disease that was spread through respiratory droplets, and the use of their airborne infection isolation rooms. This is actually kind of an adaptation of the link that you see below the CDC's website for the explanation of what an airborne isolation room is. And that really, you can think about that facility is an area where there's negative pressure that basically draws all the exhaust from the exhalation of patients and takes that out and either disperses it out, widely disperses out into the ambient air outside, or passes it through a HEPA filtration, a high efficiency particulate filtration system, before it's recirculated back into the building itself or into the room. The key component is you want to keep someone that has a infectious disease that is transmitted through airborne particles. You want to keep those particles, get them out of the room and away from others so that they don't infect really anyone else. So this is really a common mainstay and primarily developed with tuberculosis and one of the mitigation measures for tuberculosis. Most tertiary healthcare systems that are out there have facilities that are equipped with one or several airborne isolation infection rooms. A lot of intensive care units will have those. Some hospitals have wards that each room is their own airborne isolation room itself. Some emergency departments will have one room that's staffed like that. Some may have several rooms. But that really is the key to help do good infection control for somebody that may be infectious from a disease that's being spread from a respiratory path. So what we did, one of the things that we did at Lilly was to look and see, is there ability for us to do essentially the same, take and translate how hospital systems maximize their ability to manage somebody with an airborne transmitted infectious disease, and incorporate that into our medical operations. Could we develop a facility or an area where there's negative pressure clinical space that's going to allow us to, with the most certainty as possible, pull that air out from that others are exhaling in that negative pressure environment and increase the level of kind of operational safety for our medical providers? That would be an area where we could do all of our diagnostic testing, and as well as any other aerosol producing procedures, like if we're doing pulmonary function testing and so forth. We wanted the system to be part of our employee health services system, so we wanted it to be tied into our enterprise health web chart so we could actually schedule patients in. And those individuals really, for our purposes, would be individuals that were asymptomatic and they needed to be tested for one reason or another. For instance, our process that we have here at the corporate headquarters, because we have easy access to testing, our employees or contractors that have tested positive are required to retest negative prior to returning to work. So we're testing some individuals that will be asymptomatic by the time we test, as well as we're testing individuals that have mild to moderate symptoms. Obviously, those people with more moderately and severe symptoms, we're directing those to healthcare facilities. The others are still using our drive-through testing. We wanted a facility, obviously, that would be able to do all of and continue to practice all of our other infectious disease control measures, social distancing, barrier precautions for droplets, hand washing, hand sanitization, and all those other things. We wanted that to be incorporated into it. Engineer a facility that's as little touch as possible, so you have very few handrails or doorknobs or so forth that you have to manage. And then we wanted to cite a facility that could be staffed easily by our staff and with the highest level of safety for them. So we wanted an area that would have a clean side and then a side that was kind of an isolation side as well. And so I'm happy to say we were able to kind of put all those principles together into one facility. So I brought just a few photos of what we've been able to develop at Lilly. We were able to identify a freestanding building that's a little over 2,000 square feet that was being used for contractor training, for new contractors coming on, training them how to access the facility. The facility is standalone and had ample parking. We've taken this facility through a series of modifications to actually turn it into an airborne isolation testing facility exclusive for Lilly employees and for our needs. So what you see here is kind of the front of the building itself. In the parking lot itself, where individuals will park, there'll be telephone numbers, the telephone number for the back desk that you can see kind of through the windows on the right-hand side, where individuals that if they're scheduled, they'll drive in, they'll park, they'll have in front of them the telephone number to call that rings to the front desk. They verify their appointment, their time, and the car actually serves as their waiting room. There's no waiting area in the building itself. So they'll receive directions on when to come in and how to access the facility from the front desk itself. There's an intercom system and a lock. The front doors are locked. And so they'll do verification of who they are and what their time is. And then whenever they enter the building, they go into this vestibule that you see here on the right-hand side of the picture. That door, obviously, the silver door in the distance will be closed, but that is the kind of the beginning of their negative pressure isolation. There's another intercom system that's on the glass wall that you see to the right. And what you see to the right is through the glass is kind of the clean area where the staff is. Once they're verified that they have the appointment and we understand why they're there, they'll be buzzed in, and the door that's in the direct foreground will open. And then you'll see in the left-hand side, they would pass through that door you see on the left. And then there's 2 airborne isolation rooms. We don't have our office equipment in there yet, or the exam room equipment, but we're going to have 2. We're going to have an exam chair in there that's going to be appropriate for them to be evaluated, for them to have a COVID collection or sample testing or being given a vaccination, perhaps. All of those are negative pressure rooms. And then and you see a kind of an image of one of those on the right-hand side. And then the outside of those rooms, we have a benchtop laboratory space area. They have a designated restroom that's actually been converted into a restroom that we can do drug screens through. So if we want to use this facility for cause, reasonable suspicion, or pre-employment drug screens, we can use it for that area, for that purpose as well. The picture below the one on the left is you turn, you're looking into kind of the clean area, and what you see that's the area where the staff will be. That door, again, will be locked, badge access by staff only. There'll be a donning and doffing station just to the immediate left of that door, where personal protective equipment will be taken off after the interaction with the patient before the staff member goes into the clean area on the side. And then the picture on the right you can see is the staff area, and then on the glass doors you can see is the looking out kind of in the vestibule. So this facility will be able to manage kind of 3 staff members comfortably at any time while maintaining social distancing with a clean side that is for the staff normal operations, and the isolation side that has full visibility to the clean side for patient care. And so this is just a kind of a quick, since I thought it was kind of neat. These are actually with the topic of the wave topic that Enterprise Health has for this. This is actually the sensor controller that we have for opening and closing the doors is actually the wave sensor. So I brought this slide just to kind of finish up.
Well, thank you, Dr. Williams. Really interesting concept, and I know you guys are, at least as far as I know, the only client we have that is kind of, this link to create a, a space like this for your employees, which is fantastic. Okay, next up, we have Scott Tucker. And Scott is the co-president of Maple Leaf Farms, and Maple Leaf Farms is actually the largest producer of duck in North America, and you can find their duck and chicken products in restaurants and retail operations all over the world. Now, unlike most of our COVID-19 webinar presenters, Scott's actually not an occupational health expert, but he's been thrust into kind of a unique position as he leads operations for his family-owned poultry company. And I think most of us have probably seen a lot of news reports talking about how protecting workers from COVID-19 and food processing has certainly been a challenge. And I know that Maple Leaf moved very quickly and aggressively to invest in workplace health and safety, and they're using our Channel 19 application to track employee symptoms and to start to manage contact tracing. Full disclosure, I will say I am a member of the Maple Leaf Farms Board of Directors, so in the last couple of meetings, I've learned about how the company is responding to the pandemic. And so I really wanted to get Scott an opportunity on one of our webinars to share what they're doing with a wider audience. So with that, I will turn it over to Scott. And Scott, let me bring up your slides here.
Well, super, Jeff. Thank you very much. And good afternoon, everyone. Really appreciate this opportunity to talk to you about Maple Leaf Farms and our response to this horrific pandemic that we find ourselves in. Just a little quick overview of Maple Leaf. Jeff was nice enough to mention a number of these points. We're a fourth-generation family-owned poultry processor. Again, we're the largest fully integrated processor of duck in North America, as well as we further process chicken into a number of delicious products. One of the other benefits of growing duck is you get some wonderful byproducts off of that, namely down and feathers that we use in the manufacture of bedding products that you might find at places like Crate and Barrel or in the comforter you buy from Casper. We are also one of 4 primary breeders of duck in the world, which essentially means that we've developed our duck genetics and we sell it to other duck processors who value its performance. We have 1,000 employees worldwide, and we are headquartered in northern Indiana. So just to share a little bit about our COVID-19 journey, in March and April, we certainly were in a discovery mode. As a critical infrastructure business, we were designated that along with obviously lots of other food processing companies. We're very fortunate to remain in operation, but given that we just continued our operations, we had to move very, very quickly in terms of understanding what this virus was about. We certainly didn't know a lot about it. Obviously, CDC guidelines were changing rapidly. We attended webinars and industry meetings pretty much ad nauseum to learn as much as possible. And all of that was first and foremost trying to protect our workforce. As we learned more about COVID-19, we began to establish written policies and procedures as well as a COVID-19 playbook, which established written guidance for mitigation and compliance. One of the other things that we did very early on, which I think really helped our entity and certainly our relationships in the community, is cultivating a relationship with our local health department officials. This helped with the perception of Maple Leaf with that health department. I think especially early on when there were a lot of questions about the impact of the virus within the poultry industry. There were a lot of reports, and certainly at processors much larger than Maple Leaf Farms, of hundreds of people succumbing to the virus. We wanted to get out in front of that, share what we were doing with health officials to protect our workers, and I think that really helped develop a lot of confidence in the systems that we were working on. Also helped provide us with ongoing updates and information that were really vital to establishing and updating our ongoing protocols. So the protocols that we established follow CDC and OSHA guidelines and have from the outset really fall into 4 categories: engineering controls, sanitizing and disinfecting, COVID-19 controls, and administrative controls. So let me describe a little bit what we instituted within each of those categories. As Jeff mentioned, I'm in charge of our operations areas, so I'm really focusing on all of those areas in this presentation where we have the vast majority of our employee base. And the first thing we did from an engineering control standpoint is establish physical barriers in all of our operations areas. And given the integrated nature of our business, we really had to look at a lot of different areas. We have a number of operations, including hatcheries, feed mills, but the area that really required the most diligent work was in our processing plant. And the pictures you see here on the screen are really highlighting what we did in those processing plants. As you can kind of see, our processing lines were really never set up to provide the 6-foot distance between employees, as has been suggested by the CDC. So in the areas where that 6-foot threshold could not be met, we had to develop and erect physical barriers such as strip curtains. You'll see that kind of in the lower left-hand picture, as well as disposable barriers, which you'll see in the other 2 pictures, that were really critical to ensuring social distancing between employee positions. As well, we had to ensure that employees were protected through their break periods. They obviously spend a significant amount of time at lunch or on breaks, and we need to make sure they were safe during those times. So we had to erect physical barriers in a variety of places in those types of common areas, including at lunch tables and hand washing stations, as you'll see pictured here. We also had to look at all the touch points within those commons areas for potential cross-contamination risks, which led to us installing touch-free dispensers for a lot of common items, things such as coffee and water, of all things, things that you might not think of otherwise, but could be a vector for the virus. At the absolute outset of this pandemic, we quickly moved to try to add hand sanitizing stations, which at first were in very, very short supply. As you see pictured here, we initially had to just put jug dispensers seemingly everywhere until more, touch-free dispensers were more readily available, which we now utilize. We also had to physically think about how employees clock in and clock out, during their shifts, and if that could be a vector for spreading the virus. And this resulted in the installation of additional time clocks in a variety of places. Finally, we had to take a really hard look at our HVAC and ventilation systems. And while we've not gone the route of HEPA filtration yet, as in the case of what Lilly has done, we certainly increased the velocity of air exchange within our facilities. And we have to be very careful in terms of that velocity and in terms of the differences in negative and positive pressure, as it could impact the actual product itself. And so we have to absolutely make sure that it doesn't impact food safety or quality of that product. So in terms of sanitizing and disinfecting, and while we continue to perform mandated cleaning and sanitizing on our plant floors daily by USDA requirements, we have significantly increased the frequency of cleaning in commons and welfare areas. We actually have employees assigned within all of our facilities to provide sanitizing of frequently touched surfaces. They do it every 2 hours and before and between breaks for our employees. We also are performing deeper disinfecting and misting of commons areas between shifts daily with USDA approved sanitizers. So in terms of COVID-19 controls, we have had to quickly install areas for employee screening and additional break room space, because we essentially did not have enough break room space to begin with to ensure that 6 feet of social distancing. So while, as you see in these pictures, the screening and the break rooms are in the same space, they are physically separated. Now, the screening that we do every day includes temperature taking as well as a system assessment questionnaire for every employee of our processing campus. And every single employee, whether they work in the processing facility or not, goes through these particular screening areas. Now, there's a lot of debate and question about the efficacy of temperature taking. That certainly can be questioned. And as we found out, it can be very difficult when you have colder weather conditions outside. And as we had to get started very quickly inside of a tent, as you see there on the left-hand side picture, thermometers don't always work very well when it's cold outside and you don't have the tent heated enough. So we had to do a lot of scrambling to make sure that was adequate so that we had adequate assessments of people coming into our facility. But we really felt very strong it was one more line of defense we could take to prevent a facility spread of this horrible virus. To conduct this screening, obviously right now we're utilizing these rented tents, but we hope to eliminate these colder weather issues in our screening by moving to modular units that will be installed here before the colder weather sets in. Additional COVID-19 controls. Next, we implemented an employee training program, which we developed in-house, was specific to Maple Leaf Farms. There's a PowerPoint with voiceovers in English, Spanish, and Burmese. We have populations of all of those speakers in our operations. And through that, we've provided facts related to COVID-19, how to protect yourself and others, and certainly what Maple Leaf is doing to protect its team members, to try to give them a sense of the things we're trying to do to protect and support all employees. We also developed control program audits to ensure that we continue in compliance with CDC and OSHA guidelines. The CDC facilities checklist audits are done monthly, and we utilize the guidance that's issued by CDC and OSHA specific to meat and poultry processing facilities, and is specific to the following controls: the ability to maintain social distancing, promote hand hygiene, identifying and excluding sick workers from working, providing education, training, and communication, as I just mentioned, cleaning, sanitation, disinfection, providing PPE and face appropriate, and evaluating and maintaining appropriate ventilation internally. As well, we also do random verification audits to ensure that that 6-foot spacing is being maintained, where people are masked properly, physical barriers and face shields are in place, signage and floor marketing are being maintained, and certainly hand sanitizer, very important, is in place and being used consistently, as well as the common areas being sanitized on a regular basis. Finally, in terms of administrative controls, as I've already mentioned, we perform screening prior to entry. We also provide visual cues as reminders to maintain social distancing on floors, of time clocks, and a variety of other areas. It can get congested within some of these break room areas, and it's important to maintain those cues. As well as we're also forced to adjust our start and break times to reduce density within our break room and commons area. Also, as no surprise, we implemented a mandatory face covering policy, and Maple Leaf certainly provides masks as needed to all employees, as well as in jobs that are not stationary on the production floor and the 6-foot social distance room cannot constantly maintain. Maple Leaf provides face shields to those positions in addition to the wearing of the mask. Obviously, part of our controls involves continually discussing personal hygiene among our workers. Unfortunately, we've had several of our workforce contract the COVID virus. And although none have had serious consequences from the illness, we're very fortunate for that. And given that we have had no traceable spread of the virus within our facilities, unfortunately, our employees have contracted the virus outside of the workspace. So in trying to understand the spread and do the contact tracing, most of the employees that have been exposed were either living in communal living arrangements or been participating in carpools to get to work. So as you can see, it's been really critical for us to educate our employees about the dangers of whether it's communal living or particularly the carpooling aspect of it. Finally, we've certainly maintained a very liberal policy of asking employees to stay home if they exhibit any symptoms of COVID whatsoever. We are strictly following CDC guidelines in this regard and typically see employees out 10 to 14 days when they're symptomatic or in some cases asymptomatic on paid leave. So from an employee tracking and tracing perspective, we are evolving as a company. Early on, we participated in several webinars, including the Channel 19 one, to understand how best to manage tracking and tracing. At the time in April that we had viewed some of those, we weren't having a lot of cases, and keeping track of everything on a spreadsheet really seemed to be working. Unfortunately, a month later, we understood how overwhelming spreadsheet tracking could be and begin the implementation process of Channel 19 with Enterprise Health. We now have a streamlined system that not only tracks encounters, but provides much needed reporting. And we are now working with the team at Enterprise Health to establish contact tracing contact tracing through the system as well. Now, we were really impressed with Enterprise Health's system and giving their strong systems background in the healthcare field with patient care. Their software is making it much easier to track employee issues for our occupational nurses as well. And their contract tracing module will eliminate another spreadsheet or form-based process for us also. And it's going to allow us to quickly see if we have workplace exposure or spread of the virus. This is something that we've had to manually track to date, and it's very, very time consuming. So it'll be very nice to provide a more automated documentation to support the fact that we haven't experienced workplace or exposure or spread here at Maple Leaf Farm. So we're appreciative of Enterprise Health and their partnership and the support they're bringing to our operations during what has been a very, very challenging time. So thank you very much. Jeff, I'll hand it back to you.
Okay, great. Thank you, Scott. And last but certainly not least is Letitia Heshmat. And Letitia is Director of Employee and Occupational Health at a company called MobileMed. We first started working with Letitia many, many years ago when she was managing the occupational health program at Stanford University. And while she was doing that, she actually led the selection of Enterprise Health as their employee health electronic medical record solution. And after a few years as a client, Letitia actually joined our firm in a sales role on the West Coast of the United States. And after doing that for about 3 years, just a few months ago, Letitia decided to leave our firm and she joined MobileMed, and they're an innovative company that provides occupational and employee health services to other employers on an outsourced basis. So Letitia is once again a client, and in the last few months, we've worked together to deploy Channel 19 to help several California state agencies manage COVID-19 symptom monitoring and testing efforts. So Letitia, I will turn it over to you, and let me pull your slides up.
Thank you. And I know I need to be cognizant of time as well, so I'll try and keep things brief. Good morning, everyone on the West Coast, and good afternoon to everyone on the East Coast. Pleasure to be having a conversation with you here this morning and talking to you a little bit about what Enterprise Health asked me to share this morning, which is what we're seeing in the workplace, what steps employers are taking, and kind of what trends are that we're seeing, what employers are doing with regards to their COVID response and how they're riding the wave. So just to share a little bit with you about MobileMed and what our core competencies are, we're an on-site occupational health provider. We specialize in employee health programs for employers of all sizes. We're currently working with a large array of institutions and sizes of employers. We have some manufacturing, food manufacturing companies, as well as some larger product manufacturing companies. We're working with software companies, some construction as well on site. We've been working with some of the largest amusement parks in the United States. We're on site at several international airports, and we're working with some government agencies as well. So you can imagine with the varied number of employers that we're working with, the needs are very different as well. Originally, we were a West Coast-based company that quickly gained a national presence with COVID, and we're actually opening, some of our software companies have a global presence that we work with and have asked and incorporated our services to the reopening of all of their sites as they look to reopen at the end of 2020 here and the beginning of 2021. So we actually are opening our first clinic in Estonia next month, which is very exciting. And employers are making both national and international introductions as far as clinics go in their reopening process. So we create customized programs, and they can be delivered everything from intense, which is some ways that we had to deploy very quickly for employers who needed to have rapid testing done via mobile vans. We work within employers' buildings. We do on-site and near-site clinics as well. So not all employers have a place for a large on-site elaborate clinic. And so we're able to meet the needs and pivot with the employee to see what types of services they may need and provide that. So to highlight some of the measures that employers are taking for COVID safety in the workplace, a self-attestation at home before coming to work is definitely something that employers are looking at. They've implemented either through their HR solution or through their a clinical EHR. And so doing a screening at work, at home before coming to work is something that a lot of employers will do. We also very commonly see questionnaires upon site entry. So we are actually placed at some locations where they need to do attendance screening and make sure that there have been questionnaires answered prior to entering the building. And some do that and actually monitor, and others will just go ahead and do a verbal or an oral questionnaire before entering the site. Here we are at one of our construction sites, actually, and that's one of our attendance screenings at one of the major international airports. So temperature monitoring programs, as you've heard from our previous panelist, temperature monitoring programs are something that a lot of employers are implementing. And if you have multiple entry points to your building, if you have a large volume of employees, some employers are opting to utilize our services for thermographic imaging. And you see a picture of one of our thermographic imaging cameras here. You can actually incorporate questionnaires or have someone asking the questions while they utilize the thermographic imaging cameras to see if they post a temperature prior to entry as well. So we have a lot of employers that are doing that as an additional layer. So here's a few of our employees at a local hospital. California, depending on the region that you're at, mandates are very different, as well as what industry you're in. California in particular, for all healthcare workers, as well as skilled nursing facilities needed mandated antibody testing or mandated PCR testing. We also offer antibody testing depending on what the employer would like, but there's a wide variety of employers that are doing either baseline testing for surveillance, whether that be weekly, monthly, post-exposure testing, and some employers that are offering to do it as a wellness screening for return to work, or just a nicety for employees to feel more comfortable. If they'd like to have testing, they can have testing available on site. So we see PCR is the most common, as the gold standard, but there are employers that prefer the rapid antibody testing on site as well. And surface testing, something that we also have employers that are asking for, and we've partnered with a surface testing company to see if their janitorial is doing the cleaning up to par like they'd like to have it done, making sure their sanitization practices are working, and they do randomized surface testing to see if they're having any cross-contamination or if there's any surfaces that may be contaminated in the workplace so that they can up or better their cleaning protocols in the workplace. One thing that we very commonly see are employers that implement a temperature monitoring program or work with their HR system and implement screening questions, and they feel like they're taking this layered approach and they're doing the parts that they need to. But early on, while implementing all of these screening protocols or safety layers in the workplace, some forget to really have a protocol in place and handle what do we do when an employee tests positive. So we have this temperature screening protocol. We haven't had a positive. Now all of a sudden we do. And how are we going to handle that? So while employers are definitely getting ahead of that, being that we work with employers of all sizes and not everyone has a robust program, like, for example, Dr. Williams in the Lilly program, some employers put in these safety measures and didn't have an established protocol for really what they're going to do when they do have a positive, and how that positive may present itself and what the various options are that can protect them. So having established protocols in place are really important. Have those protocols reviewed by an occupational health provider, an infectious disease provider, using the CDC and OSHA as guidelines as well, and making sure you have all of the preparation that you need for when you do have a positive, what's going to happen. Typically, if we have temperature monitors on site, testers or screeners on site will provide PPE immediately if someone does pose a temperature, and assist them in escorting them out of the building or out of the tented area that we may be working in. So definitely making sure you have a protocol, how to handle it, making sure you have PPE on hand and making sure they're wearing that PPE if they're around anyone and they do post a positive for whatever that screening measure may be. And then making sure you have return to work best practices as well. So we have them leave the building, we have them off work, but are you following a symptomatic approach to return to work? Are you following a testing approach to return to work? And how you can help with those return to work clearances or things that we're helping employers with as well. And then the last part that employers also will kind of leave as kind of a last resort is now we're getting these data similar to what as Tucker said, we were on, spreadsheets for a while, and that's something that we hear very often. A lot of employers will try to manage it through their HR system or with spreadsheets, and very quickly realize as didn't go away in a month or two and is not going away for the foreseeable future, we need a way that's sustainable that we can record and report this data. Some of our international airports are having audits done by the various counties and cities that they're located in. How are you able to really record all of that data in an organized manner and have these audits be in compliance for these audits and have an organized reporting measure for you? So that's really important. And as Maple Leaf Farms did, and with my previous experience at Stanford and working with Enterprise Health, we also chose to utilize the Channel 19 platform for all of our data for employers that we're working with. And we've utilized Channel 19 to make sure that we have all of that data in one place. So how do we do so? You can include your symptom monitoring and self-attestation through the solution. And then Jeff, you can screen through kind of quickly here on this last one. You can put your testing results. So really important that your results are not only kept, but that you're able to communicate them and you're able to pull reporting from them as well. So we have a interface with our national lab. All of our test results are through that lab. The patients can see their data on the patient portal. They're able to actually access their test results through the portal. We're able to communicate a work status to the supervisor or to HR with regards to their testing and their return to work dates and anticipated dates around that. And also do contact tracing and any follow-up with the employees. So the most important is to have a plan, have a team. It really does take a village. And if you don't have an on-site occupational health clinic per se, have resources and professionals that can help you with that and help you organize the solution. So those are some of the things that we're seeing in the workplace currently. It's definitely, I've been quoted in saying it's a layered approach. It's like a day in San Francisco and needing to layer your clothes on. You have to do, depending on the region, depending on your industry, your volume, you're going to have to take a layered approach to safety in the workplace that's going to work for your exposure in the workplace. And luckily with Enterprise Health and the group here, you've got a lot of resources to pull from. So thanks for allowing me to speak today.
Great. Thank you very much, Letitia. And yeah, thanks to all of our presenters. This has been fantastic. Some really interesting things that you're doing and dealing with. So what we'd like to do now is, and I'm going to ask Ashley Ross from BRI to help me out here too. What we want to do is facilitate some Q&A with the group, and I would remind you that you can pose questions using the chat feature in WebEx. And we'll get to as many of your questions as we can, and I know we prepared some questions as well. So Ashley, do you want to maybe start us off with a couple of questions?
Absolutely, Jeff. Thank you so much, and thank you again to our speakers. I think we're going to go back to Dr. Williams. So Lilly is not only a pharma company, but it has a long-standing reputation for an employee-focused culture. Can you comment on how your involvement in life sciences and healthcare, as well as that culture, has influenced your response to this pandemic?
Well, that's a great question. It's been huge. So Lilly has had employed health services. Not only does Lilly as a pharmaceutical company, we really see ourselves as a healthcare company and organization. So really, at the core of our foundation is care, custody, and service to others in the healthcare field. So that translates also to the care company that we take for our own employees. Lilly has had employed healthcare providers on staff since 1916. So we have a long storied history of providing care and services. So coming in as the medical director for our corporate health services has really kind of been a huge opportunity to not only translate what we can do from an occupational health perspective and a acute care and minor primary care health perspective for our employed population, but really to invest in what the company's mission is as far as helping to care for others external to Lilly. So one of the things in my role in my organization has been able to do is we are touching essentially every other organization in the company that have had involvement in helping with the pandemic response plan, from consultation with our group and provision of supplies and services to the PYAD, which is the new monoclonal antibody that is finishing its phase 3 trial work now, to delivering my organization does contact tracing and positive notification, as well as symptom surveillance for all of our employee and contractor personnel. So really, it's been an incredible opportunity to focus internally on our employees, as well as to participate integrally as a component to the COVID-19 response initiative that the company has globally. And it really has just been an incredible opportunity.
Great. Thank you, Dr. Williams. We do have a question from Janet that just came in. How are companies leveraging their EAP suppliers as part of the overall strategy?
I would be happy to kind of go first with that. So we've seen we have a corporate contract for domestically, and then I'll talk about in the U.S. We have, for our U.S. operations, we have contracted with a service provider for our EAP services. We're also one of the few companies that have an on-site EAP provider in our headquarter facility in Indianapolis. We've seen a marked increase in requests for EAP services, really since the beginning of the pandemic. Even though we've moved our on-site provider to an off-site work-from-home location, I've integrated our on-site EAP provider with our well-being coordinator, and they have worked kind of seamlessly together to choreograph the resources that we have for our virtual EAP provider that provides telephonic services for the rest of the United States, and really pull together programs specific to requests from different organizations and functional groups within the company, as well as kind of some larger well-being, emotional, psychological well-being programs for the company. So it's really been a kind of a great combination of services, leveraging my on-site provider services that are currently working from home and integrating them in with our telephonic services.
Wonderful, Dr. Williams. Thank you. Letitia, Scott, did either of you want to respond to Janet's question on leveraging EAP suppliers?
Not at this time, Ashley.
Okay, great.
Yeah, I think it's probably, given Maple Leaf's size, not something I can speak to very eloquently.
Scott, a different question for you. I know, Maple Leaf has managed to pretty successfully mitigate risk and avoid, COVID outbreaks that we've seen, at the severity level that other food processing operations have experienced, which you kind of touched on. And that's really impressive kind of, given the size of the company. Can you talk a little bit about, kind of how the company culture and values has helped to guide decision making and the pretty significant investment that you've made, in protecting your employees and kind of navigating your way through this?
Certainly, thank you. That's a very good question. And, as a family-owned operation for the last 62 years, our culture of, really looking at employees almost as an extension of our family, sets a very high bar in terms of, us working very quickly and diligently to protect those employees from the outset of this. So, our question never was, you know, should we be protecting them? It was, what are all of the aspects that we need to do and get in place as quickly as possible to protect them? We, as I mentioned, you know, given we're a critical infrastructure business, you know, people in food processing really were at the forefront of trying to understand how, you know, to mitigate, you know, this virus spread. And so it was really just, you know, all hands on deck in terms of trying to find, whether it be, you know, PPE that we would have to import from China and other far-flung places, you know, to, you know, this outreach to health department and employees here at a local and state level. There was never any question about we're going to do anything and everything we have to do that. And you know, we're not certainly the size of like a Lilly, but we anticipate spending as much as $1 million for all of our COVID-related protection efforts by the end of this fiscal year. And in some years, that could be 20% of our profit. In some years, it could be 100%. That's how seriously we take it.
Gotcha. Thank you. Hey, Letitia, you know, I know that Mobile Med works with, you know, different employer organizations in different industry sectors. Are you seeing differences in the way your different clients in different industries are handling COVID-19? And are there, you know, like variations between, for example, you know, your government sector clients and your private sector clients?
Certainly. And I think most of that has to do with the industry they're in and based off of the regulations for the public health department for the state. So where healthcare workers and skilled nursing facilities need to follow a very regimented testing protocol, when you're in a larger software company where the employees can work from home very readily and their level of exposure is obviously very different than our hospital employees and healthcare workers, are going to have a completely different approach, for them not even needing to come into the office. But when they do, the level of exposure is obviously very different, and the regulations don't require any level of testing. So what we see from companies that have a lot of virtual workers that are not mandated to come to work for any reason and are not deemed essential workers, you're seeing a lot more of a more wellness approach to when you come into the office. These are the safety measures that we're taking, but here are niceties that we're offering. We're offering, you know, a clinician on site now to answer any questions that you have. We're offering the flu shots. We're offering COVID testing for you. We're offering different things like that, where it's more of an optional and wellness approach to it. Where with our more public-facing healthcare workers, they're needing to do testing on a weekly basis and other areas on a monthly basis. And then there's a lot higher volume of, more medically based exposure testing and just testing in general than there are just more of the nicer wellness features of, questionnaires and social distancing, etc. So I think it has a lot to do with the industry that you're in, as well as your geographic location, obviously, and everyone's following that testing per the Department of Public Health and what's required of them first.
Okay, great. A question we just got from the audience here is for any of you. Can you provide your input on the value of a self or home attestation information gathering versus on-site, and is there a preferred way? And I'll make a comment and then certainly open it up. I know that we're seeing, with many of our clients, what they're doing is they're, for example, using Channel 19 to encourage employees to fill out a symptom monitoring questionnaire from home, and as they fill out that questionnaire, if they answer affirmatively that they've got symptoms or have had exposure, then they get an immediate message, encouraging them to stay home, to not come to work. So, there is value if you're talking about, employees who might be symptomatic, who might have had a recent exposure, to rather than having them come into the office or into the workplace where they could be exposed to other people, even with protective measures in place. Kind of that at-home approach, is often preferred. Now, certainly there are some employee populations where that's just not realistic or not possible. So gathering that information on site makes more sense. So I think, again, a lot of it has to do with your workforce and your work situation. But we've seen that a lot of our clients have had a lot of success with doing things in advance before people ever head into the workplace. So certainly interest like. Yeah, go ahead.
Sorry, Jeff. I was going to say I can echo on that too. We have a lot of employers that are utilizing various methods, and you can think some of whom have started with one method and have switched to another. I think Jeff's comment about it being depending on the workforce is very much an important thing to factor in and to consider. We've seen employers that are doing a home attestation before coming to work, but compliance, very frankly speaking, is an issue there. Is it just something that they get used to checking the boxes for every day? And are they really asking themselves those questions before they come in? Or does it just kind of become driving an autopilot and not thinking about some of the questions that they're answering? And then with some, workforces, you have groups that feel pressured to come into work and may answer yes or no to the questions in order to pass the screening, but feel like they need to come into work because they are scared of a performance issue, or they don't want to be home, or for whatever reason it may be, they come into the workplace even though they have failed the screening. And we had an employer 2 weeks ago actually that moved to a documented attestation at work as a questionnaire as a part of their screening process, because they had an employee who admittedly did the questions at home and came to work not feeling well, but didn't have a fever, so thought that would be okay. And it ended up being a major issue and an exposure situation at work. And so, just for their peace of mind and moving forward, they're doing an in-person screening where they ask some questions. And so I think it's very dependent on the workforce that you're working with, the industry that you're in. But I think documentation is the key, that they really have to go through and document the answer to those questions instead of just ask yourself these questions before coming into work, is where we've seen the most success that employers have had.
Gotcha. Dr. Williams or Scott, any other comments on that question?
Yeah, Dr. Williams, I would just, I would agree with everything that Letitia has said. We have kind of run the gamut ourselves at Lilly, and we do kind of a variety of things. I think the biggest thing that we did that has had the most success really is to just be very basic with it, of setting the expectation within our culture that says that if you're sick or you have symptoms that are concerning, don't come to work. Contact your manager, interface with that, and then we've built programs around that. And if you've been exposed to someone that's sick, don't come to work until you've had a consultation with a medical professional or your manager that helps advise you of what steps to take. So, all of our processes that we've put into place, which includes having signage at every entry point into a Lilly facility that has people review the symptoms and so forth, to our Indianapolis-based employees and contractors utilize a self-developed application where they attest to, and they do simple screening and potential exposure to get basically a red screen or a green screen to come in. But all of them kind of have that fundamental principle that we continue to just reinforce of, if you're sick, don't come to work, and we'll figure out a way to ensure that you still work. And two, if you've been exposed, don't come to work until you have a conversation. And we've set up a call center within my employee health services and so forth. So I think that, but all of the concerns that Letitia has indicated we've seen those, and we do see those because we have a large population. We've set up a call center within our employee health services that's fielding probably between 25 and 50 calls a day to address some of those concerns. And overall, we're having a great success minimizing any exposure in the workplace.
Great, thank you. Scott, any comments? Or?
Yeah, I certainly agree and echo the comments of Letitia and Dr. Williams. I think that cultural aspect of, telling employees that, we just want you to be healthy and stay home. But you have to reinforce that, I think, through something other than just culture. I mean, obviously, in a poultry processing operation, we have employees that maybe are not as sophisticated, if you will, as a Lilly employee. So I think you have to give them more latitude if you have some type of attendance system that docks them for missing days. I think you have to look at those circumstances and give allowances for the potential that somebody may be ill, and you don't want that fear of getting attendance points that could eventually lead to dismissal against you. We suspended that very early, and we hope that that encouraged people to stay at home. It's been difficult for us to, I think, do that attestation from the home, although our occupational nurses have been certainly in contact with people that if they are here, and we give them the questionnaire and they answer yes to any of those symptoms, we maintain that contact with them. So it's a bit of a hybrid approach. I'm sure as we further implement Channel 19, that will give us more opportunities to do that from a home basis.
Great. Well, hey, we've got an interesting question here that I'm going to throw out to Dr. Williams and Scott, and I don't know that there really is an answer to this yet or guidance, but one of our attendees is asking if you're going to require your workers to be vaccinated once the COVID vaccine is out, and is there going to be an option there? As far as I know, I don't know that there is any hard and fast guidance on that yet, but I don't know if either of you have a point of view on that.
I can go first on that, Jeff. One, it's a great question, and one that my benchmark peer group has really bounced around is will it be a requirement? Lilly is not going to make a requirement. We have enhanced our communication regarding the need to consider and strongly encourage to consider. And then we're doing some, first time we're doing a drive-through flu vaccination, not only for employees, but family members, because exposure is an important rate limiter for people coming to work as well. But we are not going to require it within our workforce.
Gotcha.
And these are conversations that some of our employers are starting to have now, not have an anticipated release date yet. Those conversations are starting, and I'm hearing a lot of Dr. Williams' opinion on how they're going to do it echoed in the workplace. I think a lot of that will be dependent for some of our employers based on what the mandates are for healthcare workers moving forward. And then other employers kind of following in Lilly's footsteps, I think, with regards to not mandating it, but highly recommending it. But it is a conversation that I've heard that is being started now, and I don't really think majority of our employers yet have a definitive answer on how they're going to approach it.
Yeah, and I would totally agree with that. That's a conversation we're just starting to have, and in terms of even just the availability of it from the outset. So, we're pursuing that and seeing if, and then of course the other aspect of this is, within the food industry, will our United States Department of Agriculture have any requirements in that regard? And that's certainly that's our regulatory, entity that, we have to follow very closely. So we'll follow those leads and, again, culturally do what's in the best interest of our employees, to ensure that, they don't feel like they're pressured into it, but at the same time, we want to protect all of those that are here and continue to operate. Gotcha.
Well, unfortunately, and this has been a great conversation, and this has just flown by, which is a testament to our presenters. But we are out of time, and again, really want to thank all of our panelists. Thank you, Dr. Williams. Thank you, Scott Tucker. Thank you, Letitia. I know you're all, incredibly busy. We all have a lot going on right now, especially with COVID-19. So we really appreciate your willingness to prepare for this, to present and to answer questions, and to really share some impressive and innovative things that all your organizations are doing. So can't thank you enough. Thank you also to Ashley Ross from BRI Network for moderating our panel today. And helping to ask questions, and thank you again to BRI for helping us promote this. And again, thanks to all of you for attending today's session as you prepare to surf that next set of waves. Again, we have recorded this session, so we'll be sending out a link to access a recording of the webinar along with some follow-up material to everyone early next week. So. Thanks everyone. Stay safe, stay healthy, and to reiterate what Dr. Williams just said, get your flu shot, get it early, and again, thanks everyone.
Thank you all.
Thanks, Jeff.
Thank you.
Thanks, Jeff.